For our next session, a working group of the International Agency for Research on Cancer has concluded that occupational work as a firefighter is carcinogenic to humans. Evidence-based recommendations on the optimal screening approach for firefighters and greater understanding of the risks and benefits of investigational screening modalities that firefighters are currently receiving in real-world practice are needed. This session will examine an ongoing pilot cancer screening research study led by the Inova Health System in partnership with firefighter jurisdictions in Northern Virginia. Participants will learn about the study's design, development, implementation, and key lessons learned while exploring the use of whole body screening modalities for firefighters. The presentation will also highlight the collaborative framework established between a major healthcare system and local fire departments to advance occupational cancer research and data collection. Early observations from the study and considerations for organizations interested in developing similar screening initiatives will also be discussed. The speakers for this session are Dr. Bryan Bassig, who is the Director of Cancer Prevention and Early Detection Research at the Saville Cancer Screening and Prevention Center within the Inova Schar Cancer Institute. An epidemiologist specializing in cancer and environmental health research, Dr. Bassig leads studies evaluating innovative cancer screening approaches, including for populations with high-risk occupational exposures. Prior to joining Inova, he served as a research epidemiologist at the National Cancer Institute. Dr. Rebecca Coltman, who is a breast medical oncologist and the inaugural executive director of the Inova Saville Cancer Screening and Prevention Center at Inova Schar Cancer. She has led efforts to expand cancer prevention and early detection services across Northern Virginia, including launching a mobile cancer screening bus and developing research studies focused on cancer screening strategies for firefighters. Dr. Coltman also serves as a principal investigator for cancer screening clinical trials and is a member of the American Society of Clinical Oncology's Health Policy. Dr. Jennifer Lund, who is the System Medical Director for Inova Occupational Health and Inova Team Member Health. Through her work with the first responder community, she has developed programs focused on firefighter cancer screening, mental health, concussions, and overall wellness initiatives. Dr. Lund helped establish Inova's firefighter cancer screening study and continues to collaborate on research and health programs aimed at improving firefighter health and safety. Ryan McGill, who is a master technician and firefighter paramedic with the Fairfax County Fire and Rescue Department, where he has served for 19 years. He serves on the executive board of IAFF Local 2068 and chairs the Firefighter Cancer Reduction Committee, leading initiatives focused on reducing occupational exposures and advancing cancer prevention efforts. Ryan is also involved in several firefighter health research initiatives, including the Inova Firefighter Cancer Screening and Prevention Study and the Virginia Firefighters for Lifelong Health Project. In recognition of his outstanding contributions, Ryan received the 2022 Governor's Award of Excellence in Virginia's Fire Service for his successful advocacy in banning the use of oriented strand board OSB in live fire training, a critical reform that has significantly reduced toxic exposure risks for firefighters across the Commonwealth.
Thanks for the introduction. My name is Dr. Lund, and I will start off on little talking points about our program and how the study came to be. So Inova is a large health system in Northern Virginia, and the OC Health program has been around since the late 1980s. Through the history of the program, it's adapted to meet the needs of the clients and community we serve. And today we have 3 clinics. We serve 10 fire jurisdictions in our region and perform over 3,800 fire exams annually. And we have continued to advance our services to meet the unique needs of the fire service over the last 30 years. When I joined the program in 2022, a few things started to align for me that led to the collaboration with Saville and ultimately the study that we'll get to in a minute. In my prior roles as a physician in the Navy and at the DC Police and Fire Clinic, and through my training as an occupational health physician, I was familiar with occupational exposures and the tension between the medical guidelines and health concerns happening in the worker populations. Specifically for firefighters, I was aware of the concern that firefighters were dying of cancer at a higher rate than non-firefighters, yet my medical training and the cancer screening guidelines did not give me a way forward for an approach to caring for patients with concerns about occupational cancer. If they were younger than the recommended age for a specific cancer, there wasn't an indication to screen, yet they had years of exposure because they started working in their early 20s, and there wasn't a guideline for this. I noticed that the fire jurisdictions in our region were getting cancer screenings completed outside of their NFPA exams or their primary care doc, and if there was a finding, more firefighters would participate in those events. It seemed like the medical community was turning their back to this urgent need by not having a solution to cancer screening in the fire service. And the firefighters were finding their own solutions, which may or may not have added value or be effective in cancer detection. Shortly after I joined Inova, I learned that Inova just opened a new cancer screening and prevention center called Saville. I reached out to Dr. Kaltman to see if Saville would be able to screen the firefighters we saw for NFPA exams. This initial contact resulted in a collaboration between Inova Health and Saville that continues today. We started off with focus groups and invited different jurisdictions to Saville to talk about exposures, culture, health prevention, wellness programming, etc. We had a site visit to Loudoun County Fire Academy to help the research team and providers better understand the exposure and culture in the fire service. Prince William County Health and Safety Chiefs did a presentation on firefighter culture. We also organized ride-alongs, attended conferences, and even hosted our own conference in September of 2023 on firefighter cancer, which launched the study that Dr. Kaltman and Dr. Bassig will go into. Across the country, there's a lot going on in the firefighter cancer arena, and it's definitely been taken up a notch with the IARC reclassification of the occupation of firefighting to Group 1. This study that we're going to talk about is unique in that we're comparing screening modalities that are being used today. We know that they can identify cancer, but we don't know if the methods currently used in the field are the best, most straightforward approach to cancer screening for the population. I hope the results of this study will help inform the medical community, the fire service, and drive an objective approach to cancer screening for this worker population. It's my hope that this is just the beginning of a longer and more expansive effort from the medical community to understand this unique population. While this study is helping to answer one question, there's still more work to be done. As a medical community, we need better education and focus on the importance of occupational exposures and work history during medical school and residency. There's also more work to be done to understand how genetics, exposure, foundational health, and other factors impact an individual's own health. Lastly, the guidance to the fire service on the best approach to cancer screening that is based on science needs to be developed, refined, and enhanced, and evolve with the fire service as their work and exposures change.
Hello, and thank you for the opportunity to speak today. I'm Rebecca Kaltman, a medical oncologist leading the Inova Saville Cancer Screening and Prevention Center. At Inova, we're focused on advancing the future of cancer screening and early detection. The reality is simple: early detection saves lives. Yet, despite decades of progress, the majority of cancers diagnosed today still don't have a recommended routine screening test. That creates both a challenge and an enormous opportunity for innovation. According to the National Cancer Institute, prevention and screening efforts have helped avert nearly 4.75 million cancer deaths over the past 45 years. But our current screening system remains limited. Only 5 cancer types currently have approved screening recommendations, and more than 55% of cancers still lack an established screening test. We also know that certain populations face especially high cancer risk. Among firefighters, for example, cancer accounted for approximately 74% of on-line duty deaths in 2022. This is why emerging technologies in cancer detection are receiving so much attention. On the left, you'll find some examples of what is called conventional or legacy cancer screening. These have been investigated for years and all have been proven in improving mortality or saving lives, which is the bar that is set for approval of a cancer screening test in the US. On the right are some of the emerging technologies, including blood-based testing, advanced imaging, AI-driven risk tools, and personalized screening strategies. None of these tests have yet to be proven to improve outcomes. One of the most promising developments is multi-cancer detection, or MCED blood testing. These tests analyze tumor-derived fragments circulating in the bloodstream that are designed to identify cancers that currently have no screening options. The potential is significant: earlier detection, less invasive screening, broader population reach, and in some cases, prediction of the tissue of origin to guide follow-up evaluation. But important questions remain. We still need stronger evidence regarding which populations benefit most, whether outcomes and survival improve, how to manage follow-up testing, and the impact of false positives, false negatives, and overdiagnosis. The excitement is real, but responsible implementation must remain evidence-driven. These technologies have tremendous potential, but they also come with important risks. False positives can lead to anxiety, additional imaging, and invasive procedures. False negatives may provide false reassurance, and overdiagnosis may identify disease that would never have caused harm. Importantly, emerging technologies should complement, not replace, proven standard screening approaches. Whole body imaging is another rapidly growing area of interest. Potential advantages include no radiation exposure with MRI and ultrasound-based approaches, multi-organ assessment in a single exam, and the possibility of identifying disease before symptoms develop. At the same time, there are real concerns: incidental findings, which have the potential for the most negative impact, false positives, limited evidence, cost and access barriers, and the risk of unnecessary procedures and stress. So the key question is not simply whether these technologies are exciting. They absolutely are. The question is, how do we evaluate and implement them responsibly? We're entering a transformational era in cancer screening and early detection. New strategies may fundamentally change how we detect cancer in the future. But innovation must be paired with evidence, thoughtful policy, equitable access, and patient-centered care. At the Inova Saville Center, we are proud to help lead that effort through research, clinical innovation, and national collaboration. Thank you.
Hi, everyone. My name is Bryan Bassig. I'm the research director at Saville Cancer Screening Prevention Center. And I'm going to describe a study that we're conducting to evaluate some of these new and emerging technologies that Dr. Lund and Dr. Kaltman just described. So this occupational cancer screening clinic at Inova Health System was established as a multi-component and multidisciplinary screening program for firefighters. It was established with a collaboration between the Saville Cancer Screening Prevention Center, the Inova Department of Occupational Health, in collaboration with fire departments in Northern Virginia and the Virginia Department of Health. The actual research study nested within this clinic includes 800 firefighters who are over the age of 35 years, who have at least 10 cumulative years of service in the occupation. These are volunteer or active duty firefighters. The goal is to evaluate two types of whole body imaging modalities in addition to multi-cancer detection blood tests. So of the 800 firefighters that are participating, half are being randomized to whole body MRI. You can see here the areas of the body that's scanned and included in that whole body MRI imaging. The other half of the participants, 400, are getting a whole body ultrasound. And then all 800 are getting the multi-cancer detection blood test in addition to standard of care screenings, which I'll go into further in this presentation. This slide shows the eligibility for our pilot study. It is open to any sex, active duty firefighters, as I mentioned, with at least 10 years working as a firefighter. The age eligibility is 35 years or older. These participants have not had a prior history of any invasive cancer within the previous 5 years and not currently being worked up for diagnostic suspicion for cancer. The firefighter participants have completed their NFPA physical exams through Occ Health within the past 6 months and have not received a whole body MRI, whole body ultrasound, or an MCED within the past 1 year. Women who are participating are also not pregnant for the eligibility criteria. On the right, you can see the area departments and jurisdictions that are participating in this pilot. Currently, we are serving Planning District 8, and off to the side here, you can see the counties that are represented within this eligibility. So there are four primary objectives, and several of these objectives have sub-objectives, but at a high level, our first objective is really to understand what is the clinical impact of each of these whole body imaging procedures. That is the whole body MRI or the whole body ultrasound, as well as the multi-cancer detection blood test. So we're looking at metrics such as the detection of cancers, as well as false positive imaging that results from the screening exams. As a second objective, we're really interested in looking at what is the follow-up that results following these research procedures. So once someone has the whole body imaging, what are those findings and what kind of additional testing are those findings triggering? Either medical visits, procedures, in some cases biopsies, and then also looking at the follow-up healthcare utilization that's resulting. As a third objective, we want to understand some of the psychosocial aspects of the screening regimens, in particular the anxiety that's being triggered both during the screening procedures as well as after the results are delivered. And then because this is a pilot, we're interested in several feasibility metrics, such as completion of the screening tests and questionnaires, enrolling a diverse population to the pilot study. And then we also have an occupational exposure questionnaire where we're collecting some initial data on particular exposures, years of service, as well as job titles in the fire service. And we hope to be able to make some preliminary inferences about those findings in relation to the imaging exams that we're seeing. So this is just a high-level schema of the study design and what firefighters who are participating receive as part of both the research study and the overall occupational screening clinic. So when a firefighter is interested in participating, they come into our center at Saville, where they review and signed informed consent. At that same visit, we collect the labs for the multi-cancer detection test. Participants also complete the questionnaire on occupational exposure characteristics at that time. And then we schedule the whole body imaging, and either at Saville or at Inova, which is an offsite location that are providing the whole body MRIs for the study. And then once those results come back, the participants make a appointment with one of our providers at Saville to go over all of the results, as well as any recommendations for follow-up that results from the screening exams. We also conduct a one-year follow-up after the date of imaging to see if there's any changes in cancer status at that time. The figure below shows some of the other services that are offered as part of the occupational screening clinic. So I mentioned the research component, but the firefighter participants are also receiving a comprehensive physical exam and comprehensive risk assessment. They're getting a targeted thyroid ultrasound as well as dermatology screening. For those that qualify, there's an opportunity to get genetic testing done and counseling, and also recommendations for age-appropriate screenings, as well as wellness and discussions with our nutritionist and behavioral health. This slide is just showing at a very high level the various data points that we're collecting. I won't go into detail on every data point, but we are collecting data both from our research, from the multi-cancer detection test and the whole body imaging, and also collecting the data on the clinical screenings that firefighters are eligible for as part of the program. So that includes the skin, labs, the genetic testing, as well as some lifestyle characteristics such as alcohol use, tobacco use. All of this data will be summarized as part of our dissemination activities once the study is completed. This slide is just showing a timeline of where we currently are with our research study. So the study commenced in February of 2025. There's been steady enrollment since that time. As of May 2026, we've enrolled 640 of the 800 participants, and currently are anticipating concluding enrollment in August of this summer, at which point we will do an interim analysis of all of the baseline data. So that's the imaging as well as the multi-cancer detection results. And then based on this timeline, we anticipate our last one-year follow-up for the participants to be in the fall of 2027, after which we will conduct a final data analysis and reporting out of the main outcomes. So while the study is still ongoing, we do have some preliminary observations that we wanted to share. One, that there's been extremely high demand among firefighters for these cancer screenings. There's been a sustained wait list since our opening, sometimes hundreds of firefighters that have reached out to us with interest in participating. That's required several operational workflow adaptations, including introduction of a self-scheduling capability for those interested. And this is a case where collaboration with occupational health has been very advantageous, both from a recruitment standpoint, but also anchoring to the NFPA results where we can use the data on labs that are collected as part of those yearly exams to inform some of the results from our research screenings. In terms of cancer detection, early observations, we are seeing cancers that are diagnosed across various modalities, including whole body, as well as the more targeted screening methods, including the total body skin exam. So at least initially, what it's pointing to is that a comprehensive approach to cancer screening is really needed in the firefighter population. As part of the imaging, we're also seeing non-oncologic findings from the whole body that's required follow-up. So our team here is also reviewing and assessing those non-oncologic findings that might require follow-up. And it's really highlighted the importance of having a network of specialists lined up for referrals, consultations, as well as the follow-up care that might be needed following the use of these modalities. And as part of that, there's been an extensive navigation. So of all the findings that have come back, we have a team that has been tracking these findings in an organized, systematic way through clinical case conferences weekly, as well as extensive data management in our REDCap and study trackers, really needing to continuously monitor and follow up the participants to make sure that all the follow-up care is being received. So as we conclude our pilot over the next 6 months to a year, some of our next steps, we're already kind of thinking about what the future is needed. One of the first activities will be to disseminate the data resulting from this pilot protocol, as well as sharing some of our operational experience and lessons learned during the real-world implementation of this clinic to really serve as a resource for other health systems and jurisdictions that are wanting to implement similar types of systems. Along those lines, we're also exploring feasibility of conducting a multi-site prospective study to follow up on some of these findings from the pilot. This would include whole body imaging, MSED blood tests, as well as some of the targeted screenings that are showing to be important, targeted screenings of the thyroid, total body skin exam. And as we're thinking about the study design for this next step, some of the key kind of determinations include feasibility. So what are our enrollment rates? What is the adherence and follow-up to the screening recommendations and the one-year follow-up? We're assessing clinical meaningfulness, so the detection of cancers, but also, at what stage are we detecting cancers at an early stage? What is the concordance between, for example, the multi-cancer detection test and the imaging? We're looking at downstream impact, so what is the false positive rate from the screenings that we're doing? What diagnostic pathways and burden are being triggered? And then, we're really looking at a design which is acceptable to firefighters. So is there department buy-in and interest? What is the ease of implementation of any recommendations for screening modalities that we may recommend? And just at a high level, I think one of the conclusions is, important questions remain. We're learning a lot from this pilot, but really generating data from these emerging screening modalities is what ultimately will allow us to evolve screening guidelines and provide recommendations for high-risk populations such as firefighters. And I will now turn it over to Ryan.
Hello, and thank you for taking the time to view this presentation on the firefighter cancer screening and prevention pilot study being conducted with Inova. My name is Ryan McGill. I am a firefighter in Fairfax County, Virginia, and I've had the privilege of working with the research team at Inova as the fire service representative, and not only that, being a member of the study, going through all phases of it and completing the study. I'd like to take a moment to tell you a little bit about the study, and then a few other things we'll discuss towards the end of my part of the presentation. So as you can see, the parts of the study that have already been mentioned by some of the research staff, I was randomized into the full body MRI. That was a very high level screening. I was also able to get the MSED blood test and a Vectra 3D avatar created that looks at mapping of moles to detect cancer and melanoma early. I would like to first go back and say thank you to all the members that have participated in this study, because without the members of the Northern Virginia Fire Service, we wouldn't be able to get this data that we need to progress in detecting cancer early in the fire service. One area that we are seeing from our membership is an added need to add a skin assessment as part of our regular screening. And that is something that we'll be working to do for our members. So the impact of this study on the fire service is hopefully going to help decision makers make an informed decision on what type of early detection we should be doing. I had a conversation the other day with a member of the fire service, and he said that it kind of feels like we're throwing darts at a dartboard to try and determine what type of screening we should be doing. And that's the best way that I could say it myself also. This research will help us make an informed decision on what we should be doing, because we know that the impacts of this not only impact budgetary expenses, but the impact on the member from false positives, additional workups, all those compound. So you heard Bryan say previously that we've enrolled our goal is to enroll 800 members into the study. That number is not enough to change policies to ensure that members are getting screenings. What it can do, though, is inform us and allow us to push to expand this study to get a larger data set so that eventually we will be able to affect policy change. Lastly, I want to talk about how the findings of this study is going to be communicated to the fire service. What we found is that when studies are published, a lot of times they're not easy for the fire service to interpret and understand them. So on top of a normal publication in the medical journals, the research team is going to create what we're calling a pink sheet. Basically, it will be a one-page summary that is easy for readers to understand. It will be released at the time of publication, and it'll be shared across multiple fire industry platforms. The goal is to make it so that this is something that we can, as the fire service, understand and take action on. Thank you again for watching this presentation.